A 35-year-old female presents with palpitations, heat intolerance, weight loss, and tremors. Thyroid function tests reveal elevated serum thyroxine, T4, and triiodothyronine, T3, levels with suppressed thyroid-stimulating hormone, TSH, levels. Thyroid uptake scan shows diffuse uptake consistent with Graves' disease. What is the most appropriate next step in management? A. Antithyroid medications, for example, methimazole B, radioactive iodine ablation C, total thyroidectomy D, observation and supportive care. Answer: A. Antithyroid medications, for example, methimazole. Explanation: antithyroid medications such as methimazole or propylthiouracil are the initial treatment options for hyperthyroidism due to Graves' disease. They work by inhibiting thyroid hormone synthesis. Radioactive iodine ablation or surgery may be considered if medical therapy fails or is contraindicated. Scenario: thyroid nodule. A 50-year-old male presents with a painless neck mass. Thyroid ultrasound reveals a 3 cm hypoechoic nodule in the left lobe with microcalcifications. Fine needle aspiration biopsy, FNAB, shows cytologic features consistent with papillary thyroid carcinoma. What is the most appropriate next step in management? A. Total thyroidectomy. B. Lobectomy with isthmusectomy. C. Radioactive iodine ablation. D. Observation and serial ultrasound monitoring. Answer: A. Total thyroidectomy. Explanation: total thyroidectomy is the preferred surgical approach for papillary thyroid carcinoma, particularly for tumors greater than 1 cm in diameter or with high-risk features. Radioactive iodine ablation may follow for remnant ablation and adjuvant therapy. Scenario: primary hyperparathyroidism. A 60-year-old female presents with fatigue, bone pain, and constipation. Laboratory tests reveal elevated serum calcium levels and inappropriately elevated intact parathyroid hormone, PTH, levels. Imaging studies localize the abnormality to a solitary parathyroid adenoma. What is the most appropriate next step in management? A. Minimally invasive parathyroidectomy, MIPB, total parathyroidectomy with autotransplantation. C. Observation and medical management. D. Bilateral neck exploration. Answer: A. Minimally invasive parathyroidectomy, MIP. Explanation: minimally invasive parathyroidectomy, MIP, is the preferred surgical approach for solitary parathyroid adenoma in primary hyperparathyroidism. It offers the advantages of shorter operative time, reduced morbidity, and faster recovery compared to bilateral neck exploration. A 55-year-old male undergoes abdominal imaging for unrelated reasons, which incidentally reveals a 4 cm adrenal mass with imaging characteristics suggestive of adrenal adenoma. He has no symptoms related to adrenal dysfunction. What is the most appropriate next step in management? A. Surgical resection. B. Observation with serial imaging. C. Hormonal evaluation. D. Biopsy of the adrenal mass. Answer: B. Observation with serial imaging. Explanation: asymptomatic adrenal incidentalomas with benign imaging characteristics do not typically require immediate surgical intervention. Observation with serial imaging is recommended to monitor for growth or functional changes over time. Scenario: hypercalcemia secondary to parathyroid carcinoma. A 45-year-old female presents with severe hypercalcemia, renal insufficiency, and history of recurrent kidney stones. Laboratory tests reveal markedly elevated serum calcium and PTH levels. Imaging studies show a large parathyroid mass with invasion into surrounding structures. What is the most appropriate next step in management? A. Total parathyroidectomy with en-bloc resection of involved structures. B. Palliative care consultations. C. Radiotherapy to the parathyroid mass. D. Chemotherapy for parathyroid carcinoma. Answer: A. Total parathyroidectomy with en-bloc resection of involved structures. Explanation: In cases of hypercalcemia secondary to parathyroid carcinoma with invasion into surrounding structures, total parathyroidectomy with en-bloc resection of involved structures is the preferred surgical intervention to achieve biochemical cure and palliate symptoms.